Well, I'm taking it because I have atrial fibrillation and have had for many years. And so to prevent a stroke or anything of that nature, I take Warfarin.
There was a concern that I could develop some clots, and before they proceeded with any further treatment, they wanted to make sure that I was not going to create any clots.
Well, I started on Warfarin because they found out I had factor V clotting disorder, and they thought it was the best option.
Your doctor has prescribed Warfarin for you. Warfarin, often called by the brand name Coumadin and sometimes Jantoven, is an anticoagulant. It helps prevent clots from forming. You may be taking it for atrial fibrillation, a heart valve replacement, stroke, heart attack, to prevent clots in legs or lungs, or for other blood disorders. At the end of this program, you will understand what Warfarin does, the importance of getting your blood checked regularly, and safety concerns while taking this medication. One of the most important things to know about Warfarin is that your blood must be checked within 4 to 5 days or earlier after you go home from the hospital, and then checked frequently while you take it. Be sure to talk to your doctor about this follow-up appointment. The blood test is called an INR test, and it tells how quickly your blood clots. If the INR is high, you might bleed more. Because Warfarin makes your blood take longer to clot, you may notice minor bleeding, such as occasional nosebleeds, bleeding gums when brushing or flossing, easy bruising, or prolonged bleeding from minor cuts and menstruation. If you have any of the following major signs of bleeding, call 911 or go immediately to the nearest hospital emergency department. These include excessive bleeding gums, coughing up or vomiting blood that appears a red coffee ground material, extensive bleeding with no known cause, blood in your stool that's red, black, or tarry, blood in your urine that's red, pink, or brown, or any unusual bleeding that doesn't stop.
I have noticed a little bit of bleeding on my gums, and I never used to get nosebleeds ever, and every once in a while I'll get one now, but really nothing too serious at all.
I had to get 2 pieces of pipe separated, and I was really wrenching on this, and I wasn't so much concerned about cutting myself, if a bloody knuckle, if you scrape a knuckle or something, but it started to hurt my hand, and afterwards I looked at my hand, and I had a line from where I was holding the wrench across my hand, and it was a bruise. That was a little surprising to me.
If your INR is too low, serious clots can form. If you notice any of these, call 911 or go immediately to the nearest hospital emergency department. Pain, swelling, warmth, redness, or a lump in your legs or feet. Sudden increased shortness of breath or chest pain when breathing. Or signs of a stroke, which include sudden severe headache, sudden weakness or numbness, especially on one side, sudden vision changes, sudden dizziness, falling, or confusion, or difficulty swallowing or speaking. For patients who take Warfarin for a long period of time, home monitoring may be an option. Under specific circumstances, Medicare and some insurance plans cover home INR monitoring equipment and supplies. It's important to take Warfarin exactly as prescribed at the same time every day. If you miss a dose, take it as soon as possible on the same day. If it is the next day, call your doctor or anticoagulation clinic for instructions. Do not take 2 doses to make up for a missed dose.
I just use one of the pill boxes that a lot of older people use, but it works great. So I just keep it right by my bed.
Always tell any healthcare providers that you take Warfarin. Identification is available. Many medicines, supplements, and herbs interact with Warfarin, so it's important to tell your healthcare provider about any changes in medicines or if you take any over-the-counter drugs and herbal supplements.
This includes prescription medications, over-the-counter medications, vitamins, natural supplements, and herbal medications. All of those can potentially interact with warfarin and may result in an increase in risk of bleeding in some cases, or other cases might result in an increased risk of blood clotting. So we always want to be aware of any changes in medications.
Other medications that have blood thinning qualities, aspirin and stuff, I've stayed away from that. I take mostly Tylenol products now, just because that doesn't really mess with it at all, so they're pretty safe.
I'm also taking amiodarone, and they're very concerned about the interaction there. So, yeah, there's been some bounce, and I'm certainly not on the same dose of Coumadin every week. They change it and monitor it.
I take what's prescribed and glad to have it, and that's it.
Foods high in vitamin K also affect warfarin. However, many of these foods are good for you and important to your health, so do not avoid them. Just be consistent in the amounts you eat each day.
That's a very common misconception, that people need to cut out vitamin K containing foods. But what's more important is that you eat a consistent amount each week. So if you're someone that eats a lot of those leafy green vegetables, you need to communicate that to your doctor, and you can likely go ahead and continue that, but you just want to be consistent in your diet.
A list of foods high in vitamin K is included in your discharge education materials.
I can't eat everything that I wanted to eat anytime I wanted to eat it like I could before. But I'm eating a healthy diet and I'm eating a consistent diet.
Exercise also keeps you healthy, but because you will bleed more easily, take precautions to prevent falling or hurting yourself. Regular exercise can actually reduce your risk of falling by increasing your flexibility and balance. Talk to your doctor about an appropriate exercise plan for you.
I swim 2-3 times a week, and I go up and down steps a lot every day.
They kind of told me, well, you're going to have to change some of the sports that you do. You're not going to be able to do a lot of the stuff that you've been doing. But I found out that mostly I just have to be more careful than other people. I can still do everything that I want to do. I just have to be smarter about it.
We go to the gym, we walk the dogs, we ride bikes, and none of those activities are inhibited by taking warfarin.
Notify your doctor or anticoagulation clinic if you have an upcoming surgical or dental procedure, if you stop taking warfarin, if there is a possibility you may become pregnant, if you are sick with nausea, vomiting, diarrhea, or fever, or if you have an infection. Many people take warfarin. Remember to get your INR checked regularly, take your medicine exactly as prescribed, and be alert to the major bleeding or clotting signs.
It just becomes a part of your daily life, I think. And definitely it's going to help you.
And I'm going to participate in a gym, and I'm going to exercise my heart and feel better and be better than I ever have before. I apologize to my wife on a frequent basis for not discovering this earlier.
Don't let it keep you from doing anything that you want to do. There's probably a way you can do whatever you want to do, even on this medication. It's pretty great. Like, your life doesn't have to change.